Hello and welcome to the Ask Dr. Pickel show, where we help find answers for patients with chronic health issues, chronic health problems. And today we are going to talk about an interesting topic that relates to thyroid issues and infertility. And we see this with patients where they will have these infertility issues. They've tried a lot of different things. Nothing's really helping. And, next steps can be very expensive. So they're like, hey, is there something else going on here that my doctor's not figuring out? And so we've got to look at some things. And especially one thing that we've got to look at is the thyroid, which is commonly missed. A lot of times when doctors look at thyroid issues, they'll look at a blood panel, and they're mainly going to check your TSH number and your T4 number. And if those look fairly within range, a fairly wide range, they're going to say, hey, you're fine, not a big deal here. The problem is if that's the only thing you look at, you can miss some things. And then patients end up trying some other road, and then with discounting that was ever a problem ever again. And then they can tell other doctors, hey, no, my doctor said my thyroid's fine, no big deal. And then they never really get the chance to really find out, hey, was the thyroid a part of this puzzle? But it was never checked thoroughly. It was never really looked at completely. It was just kind of bypassed as an issue, because it can be a big issue when it comes to infertility. And not only people who have already been diagnosed with thyroid issues, but people who haven't and may not even know that they have a thyroid issue. And when I'm talking about thyroid issues really with this, I'm talking about low thyroid, hypothyroid. So we'll take a little deep dive right into that. In fact, let's go ahead and start to add some things in here. So one thing we've got to look at is when we have hypothyroid or low thyroid. Yeah, usually your doctor is going to look at your TSH number, your T4, maybe your free T4. They're not really going to look at the rest of the hormones. So number one, that's pretty important, to look at the rest of the hormones. Look at your total T3, look at your free T3 levels, T3 uptake, thyroid binding globulin, some of these other aspects. The other really important thing to look at, though, is another factor of the hypothyroidism. In fact, it's the most common cause of hypothyroidism in the United States. And what is that? Now, if you watched our past videos, you will know the answer to this question. All right, but we're going to answer it right here. And that is called Hashimoto's. Yes. So Hashimoto's thyroiditis, which is autoimmune thyroid disease, is the most common cause in the United States. So what is that? Again, watch our past videos. That's going to give you more information on this. But in a nutshell, this is my immune system is attacking my thyroid gland. It's an autoimmune condition. Again, in the United States, this is just so prevalent, and it is one of the major causes. Now, how do you find out if you have this? Well, remember, I talked about testing those other things for thyroid. There's a couple of other markers that also should be tested commonly, and one of those is called your TPO. I'm just going to put AB here, TPO antibodies, and the other one, I'm going to put TGAB. So that's your thyroglobulin antibodies. You need to get these tested, because this could be a potential problem for you, because if you have Hashimoto's, yeah, that throws a wrench in the gears potentially, especially according to studies that show that people who have Hashimoto's, women that have Hashimoto's that are trying to get pregnant, it substantially lowers your success rate. Now it's just accepted as, hey, that just happens with people with Hashimoto's. Well, can something be done about it? Absolutely. But let's not get into that yet. First, yeah, we've got this Hashimoto's as a problem. So in these two, a lot of times go together as an issue. Now, how does all this kind of come together? How does all this affect, infertility? Okay, so let's kind of go on with this a little further, because one thing that happens is when you have Hashimoto's or hypothyroidism, what do we have? We have low thyroid hormone. Okay, so if we have low thyroid hormone, what does that do? Well, every cell in your body has to have thyroid hormone. So if your thyroid hormone drops low, everything in your body slows down. Your bowels slow down, constipation, uh, hair production slows down, decreased hair growth. Gastrointestinal tract slows down. I don't absorb as much or as well. My digestive system isn't working as well. My energy level declines. Just so many factors here. There's actually quite a few symptoms for hypothyroidism, and I would recommend one of our other videos for that. But at the same time, we just know that, hey, we lower thyroid hormone, this creates some substantial problems. And the other side of that story is it may not be that you need to take thyroid hormone. If we look at these other tests, we may find out you're not, because even if a person takes thyroid hormone, they're mainly taking what's called T4, and usually synthetic T4. That's usually your thyroid hormone medications. But that T4 really doesn't do a lot. It has to go to your liver, some to your gut, and a few other areas, and that has to turn into what's called T3. T3 is the active hormone that gives you metabolism, that gets everything moving and rolling. So again, another reason to look at those other hormones. So it's not always from that, but here's the other side of the story too. If you have Hashimoto's, yeah, now we've got another issue here. It's not always that you don't have enough thyroid hormone in your system. This could be from inflammation affecting other things in your body and your ability to utilize the thyroid hormone properly too. So a lot of potential problems when you have just low thyroid or Hashimoto's, to kind of start off the whole problem train there, let's call it. All right, so another thing that can occur here when you have low thyroid hormone, one thing that occurs is we get basically a decrease in the expression of, here's the word, oocytes. Does anybody know what oocytes are? All right, if you do, good for you, but oocytes are eggs. So this is the development of the egg. So pretty darn important. So if you don't have enough thyroid hormone, if your thyroid hormone is diminished or there's problems there, then the development of your eggs is going to not be substantial there. It can be a major problem. Another factor that can come into play here is you get decreased LH output. Now, LH, what is that? Luteinizing hormone. So your brain, an area in your brain called your hypothalamus, signals your pituitary gland, and your pituitary gland outputs in women, well, both men and women, but in women it does something else than men. The pituitary gland makes either what's called FSH or LH. Now, LH stimulates progesterone. But again, so if we have decreased LH output, what's that going to do? It's going to create a problem. It's going to shorten the luteal phase. So now you're going to notice, hey, my cycle's shorter. You know, I'm not going 28 days in a regular cycle. I'm down to like 25, 26, 24 days. I've got that shortened luteal cycle, which isn't good because that's going to create some other issues for us here, definitely. All right. So let's go on a little further here, and we'll explain kind of what that can do. Let's go down another thing here. Let's go to the other thing is we get decreased activation of the endometrium. I know all these words. Endometrium, let's put that as the endometrium progesterone receptors. Okay, so what is it? What the heck does that mean? Okay, so in the endometrium, this lining of the uterus that's very important for the egg to implant in, basically there's little they call them receptors. These are little doorways, little docking like a ship goes into a dock. Well, progesterone needs to go in and dock on this receptor. But if thyroid hormone is off, these receptors don't function as well. We can get decreased receptor population, decreased receptor function. Now, progesterone doesn't activate the endometrium properly. So, hey, the egg may be formed and it may come around to say, hey, I'm going to implant here in the endometrium of the uterus, but it can't because the progesterone hasn't made that tissue correct for that whole thing to occur, which isn't good. So some things that are going to happen with that is we're going to get, basically, we're going to get a change in menstrual bleeding. Because what happens if you get pregnant? If you get pregnant, yeah, that stops that whole process. Wait a second, I didn't have a period. I'm not bleeding. Yeah. Hey, you might be pregnant. Well, problem is if you don't have enough progesterone, if you don't prepare the endometrium properly, yeah, you'll bleed. You slough off that endometrium. You can't implant an egg without that. So now we get a change in menstrual bleeding. Another thing that can happen if you have that, and which I kind of just explained, we get decreased implantation. Meaning the egg can't implant into the tissue of the endometrium. So again, that's where the egg, of course, needs to be. It needs there to grow. It needs that fertile soil to set in. Let's put it that way, kind of a way to put it there. And so what happens if the egg doesn't implant? We get increased risk of miscarriage. Okay, so yeah, so this is all some very negative factors when it comes to pregnancy. I mean, if that thyroid hormone's low, you really increase your risk in multiple ways of, number one, not being able to get pregnant in the first place because the eggs are not going to be able to express properly. But then even if you do fertilize the egg, it may not implant properly, and the area that it's supposed to implant may not function properly, the endometrium. So we definitely have multiple issues that can be caused. And then the other thing too, that we can tie into all of this is if you have Hashimoto's, what's going to happen? So Hashimoto's affects the immune system. And what happens if Hashimoto's is affecting the immune system or impacts the immune system? This is going to create trouble. This is going to create increased inflammation, increased what are called inflammatory cytokines. It can cause the immune system, the Th1, Th2 balance of the immune system to have problems. Because here's the thing too, is when a woman's pregnant, basically the immune system shifts to protect the baby from your own immune system. Now the problem is if the immune system is shifted incorrectly due to already before pregnancy, due to an autoimmune issue, then it may not shift properly during pregnancy, and that can result in the immune system affecting it'll affect not only maternal health, because it can affect mom and give her all kinds of symptoms and malfunctions and problems or inability to fight things off properly. And it can affect basically the fetus. or let's say fetal health. Because if the immune system is not being kept under control and we've got a lot of inflammation in the body, yeah, that increases risk to the fetus. So again, we've got multiple things here, just basically from a thyroid issue that can create this whole troublemaking scheme. And again, it all comes back to, if someone's complaining, hey, I'm having fertility issues, that you look at the whole picture. You don't just say, hey, let's look at your TSH and your T4. That's all that matters, because if TSH is high and T4 is low, they're going to give you some thyroid medication. And that's kind of how the system is set up. I hate to say that, but that's just the way it is. Where the thing is we've got to go deeper. We've got to look at, hey, no, let's look at all the thyroid hormones and let's find out why they may be malfunctioning. Is it an issue where the brain isn't signaling properly? Is it an issue where the thyroid can't make the hormone? Is it an issue where the thyroid hormones, even though they're being made or being taken, are not being turned from the T4 to the T3? Or is it too that there's inflammation in the body and that's preventing the T3 from getting into your cells and causing that whole metabolism to work properly? So there's actually a wide variety of different things that can cause this whole thing to have problems. So it's kind of taking a step back and looking at the whole picture and saying, hey, how can these things apply? And if they do, could these be causing the infertility issue? I mean, there's definitely other causes, but this is one, and this is an important one that if it does get missed, you just skip on to something else and it totally gets forgotten, and it's never realized that, hey, this was the problem, but we missed it. And now we've already gone through all these other steps and spent a fortune on trying to get pregnant. So, okay, well, I hope this video helps, especially women out there who are couples out there who are trying to get pregnant, and it's a problem, and there's potential puzzle pieces that are being missed. So, all right, well, if you enjoyed this video, I would hope that you share it, and whether it be on YouTube, Facebook, Twitter, any of these things, because a lot of people need this type of information. If they don't get it, then they may get lost in the system and never find out this was actually the cause of their issue. So, all right, I hope everybody enjoyed the information today. Have a wonderful day, and God bless.